insurance, and our new eligibility system automatically disenrolls people who don't take responsibility to re-verify that their income continues to qualify them for Medicaid. All of this added up to a better run program, and spending is under control. From this stronger foundation, Governor Kasich considered and decided to extend Medicaid coverage to more low-income, uninsured Ohioans. The authority to operate Medicaid at its current eligibility levels does not expire, so the budget is silent on that issue. The current eligibility level is included in the appropriation baseline as introduced. One point about Medicaid enrollment. Current enrollment is 60,000 people, that's 2% below original budget estimates. Enrollment in the expansion group is above, and enrollment in traditional Medicaid is significantly below. Our plan is to continue to build on what works. Coverage supports work. About half of the new coverage group works. And for those without earned income, about half are using mental health and addiction recovery services. We want Medicaid to be temporary for everyone who can move off the program. In this budget, above 100% of poverty, we require a monthly premium, just like private insurance. We speed up the transition off Medicaid for people whose income goes up. Now, instead of 1 year, they'll have 6 months to switch to private insurance. And we require adults on Medicaid at higher incomes, above 138% of poverty, to seek coverage on the exchange. As Director Keene mentioned, this budget also makes significant new investments for the most vulnerable populations. In mental health and addiction services, in previous budgets, we elevated the Medicaid match responsibility from the counties to the state, then extended Medicaid coverage to more people. Now, in this budget, we will redesign the behavioral health benefit to be more comprehensive, then improve care coordination by moving behavioral health services into Medicaid managed care. In developmental disabilities, this is one of the most significant new investments in the budget. $316 million over 2 years, $120 million state share, all of which is used to increase choices for people with developmental disabilities so they can live and work in the community. In addition, we've been working to reduce infant mortality ever since the governor made this a priority in his first State of the State. Now we take that commitment to the next level and surge resources into communities that are the most at risk for poor birth outcomes and concentrate resources to reduce infant mortality. The Infant Mortality Initiative will be coordinated with others, like reducing maternal smoking, which is part of a much broader tobacco cessation initiative that includes the tax increase on cigarettes and sets priorities for spending tobacco master settlement agreement funds. Detail on all of these initiatives is now posted on the OHT website. Here's the really good news. John McCarthy has been managing Ohio's Medicaid program so well, we are able to make all of the investments I just described and still hold per member program growth to below 3%, and actually well below 3% in this next year. That is well within the growth target set by the legislature's new Joint Committee on Medicaid Oversight. These programs are stable. We're seeing that coverage supports work, but we are all just one untreated illness from unemployment. Being on Medicaid won't get you a better job, get you a job or a better job. There is more in that area we can do, and for that, I'm very happy to